Cassidy Donlin. Hi, my name is Cassidy Donlin. I'm a nurse practitioner. I'm going to be performing an eyes, ears, nose, and throat exam on you today. First thing we're going to test is your visual acuity. So if you can hold this card arm's length out, cover one eye, and read the smallest line you can.
LTFPH.
Perfect. And then if you could switch eyes and read that same line backwards.
HPFTL.
Perfect. And you can uncover and now read that same line with both eyes.
LTFPH.
Perfect. Thank you. Okay. Next thing we're going to do is visual field screening. So I'm going to have you cover one eye and I'm going to wiggle my fingers and I want you to just tell me when you can see them.
Now. 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 Now.
Perfect. And then we'll switch eyes.
Now. 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 Now.
Perfect. Okay. Next thing I'm going to do is I'm going to inspect your eyes. So I'm just going to, if you close your eyes, I'm just going to feel, assess for any swelling. Perfect. There's no swelling felt. And if you can just look, there's no excessive tearing in your tear ducts. They appear moist and well and no redness. Then I'm going to assess your sclera. So if you just look at me, I'm going to pull down on your eyelids. Perfect. They look nice and white. And then if you could look up, just your eyes, and down, and left, and right. Perfect. All is good. There's no excess watering, swelling, or drainage that I've noticed. Now I'm going to look at your corneas and lenses. So I'm just going to stand to the side and I'm going to shine this light in, to your eye and you can just look straight ahead. Okay, perfect. All right, perfect, looks good. Your cornea are nice and equal bilaterally, and then I'm just going to check your pupil, so just keep looking straight at me, and I'm just going to shine this light into your eye. Okay, perfect. Your pupils are equal around, reactive to light, and with accommodation. Next thing I'm going to do is look for your corneal and white reflex, so just going to stand in front of you here. I'm going to shine this into your eyes and see if the reflex is there, so just keep your eyes straight. Perfect, I see it, that eye. Perfect, they're present in both eyes. Alright, next thing we're going to do is check your extraocular movements. So I'm just going to have you follow my finger with just your eyes and leave your head still. Perfect. There's no nystagmus, no lid lag, and it was positive convergence. So the next thing we're going to do is check for deviation of your eye. So I just want you to look at me and cover one eye and uncover that. Perfect. There's no deviation. And now do the same thing with the other eye and uncover. Perfect. There's no deviation. Okay, next thing I'm going to do is I'm going to look into your eyes. I'm going to look for your red reflex, look at your retinas and your optic disc. So just, I'm going to place my hand on your head and you can just look straight ahead. I'm going to look into your eye. Perfect, the red reflex is present. Your optic disc is nice and clear. It's yellow, orange in color. The disc is normal size, or the cup is normal size. There's no hemorrhage or lesions or papillary edema noted either with the retina. Everything looks good. I'm going to do the same thing on this side. Perfect, the red reflex is present. Again, no hemorrhaging. I see the vessels crossing. 2 vessels crossing your optic disc is nice and clear and yellow, red in color. And there's no hemorrhages, lesions, or masses seen. Perfect. Okay. Next thing I'm going to do is inspect your ears. So I'm just going to feel the outside of your ears and just tell me if you have any tenderness.
Cool.
Perfect. I'm just going to inspect for any redness or lesion. Nothing there. Nothing there. Everything looks good. Okay, and then I am going to look inside your ear. Okay, so I'm just gonna pull your ear up and back, and I'm gonna look at your ear canal and your tympanic membrane. Perfect. Your ear canal is nice and pink. Your tympanic membrane is pearly white. There's no redness or swelling noted. We're gonna repeat on this side and pull your ear up and back. Your ear canal is also nice and pink in here. Tympanic membrane is pearly white. No drainage, no swelling, no redness. Looks good. Okay. Next thing we're gonna do is test your auditory acuity. So I'm gonna stand in front of you. I'd like you to close your eyes and plug one ear, and I'm gonna say a word, and I just want you to repeat it.
Football.
Perfect. And we can switch ears.
Soccer.
Perfect. Okay, next test we're going to do is a Weber test. So I'm going to take this tuning fork, I'm going to place it on top of your head, and I want you to tell me if you can hear it better in one ear versus the other, or equal bilaterally.
Equal.
Perfect. All right, and we'll move on to the Renee test. So I'm going to start the tuning fork. I'm going to place this behind your ear, and then I want you to tell me when you stop hearing the sound, and then I'm going to turn it, and I want you to tell me if you can still hear it.
Stopped. Yep.
Okay, now switch sides.
Stop. Yep.
Perfect. Both ears are good. Okay, next thing we're going to look at is your nose and your sinuses. So I'm just going to look at your nose. I'm going to palpate and just tell me if there's any tenderness or anything as I do. No tenderness, no swelling. It's nice and midline. I don't feel any deviations. And then I'm going to test your nasal patency. So I just want you to plug one nostril and sniff for me. Perfect. And then repeat with the other side. Perfect. They're nice and patent. Next, I'm going to look into your nose using this, and I'm just going to see if there's any drainage or swelling or anything going on in there. So if I could just have you tilt your head back up. I'm just going to place this gently into your nose. And look. Nice and pink. Looks good. No drainage or swelling occurring. Repeat on the other side. Good. Nice and pink. No drainage or swelling. Good. Okay, now I'm going to check your sinuses. So I'm going to check your frontal sinuses and your maxillary sinuses, and when I press on this, just tell me if there's any tenderness.
Nope.
Okay, perfect. All right, moving on to your mouth, I'm just going to take a look at your lips. They look nice and pink. There's no cracking. They look moist. Everything looks good with that. Next, I'm going to look at your oral mucosa. So I'm going to use this tongue blade and look inside your mouth, and then I'm going to look at your gums and your teeth at the same time. Okay? Perfect. It's nice and pink. Doesn't look like you have any missing teeth. They're all in the right spot. Gums are nice and pink. There's no swelling, no bleeding, no caries. Everything looks good with that. All right, you can take a break, and then I'm going to look at your hard and soft palate again. So, and then I'm also going to look at your tonsils at this time. So, if you can open your mouth again. Okay, hard palate is nice and pink, no masses, lesions, anything. Soft palate, it's also nice and pink. Your uvula is centered. Now, can you say ah? Perfect. Your tonsils are grade 0. They're nice and pink, no swelling or lesions on them. Okay. Next, I'm gonna have you just stick out your tongue. Just make sure it's perfect midline position. It's pink. There's no lesions on it. And then the last thing we're gonna do is your lymphatic. So I'm just gonna palpate your lymph nodes, and I just want you to tell me if there's any denoted. Okay. So first, I'm gonna do your preauricular, postauricular,
Nope.
occipital,
Nope.
then your tonsillar,
Nope.
submandibular,
Nope.
then your submental,
Nope.
then your superficial cervical,
Nope.
right there, then your anterior cervical,
Nope.
your posterior cervical,
Nope.
supraclavicular,
Nope.
and your interclavicular.
Nope.
Perfect. And I did not feel any lymph nodes and no tendinosis present, so all of that is normal. And that concludes our exam.